Outstanding care, no exceptions.
Our mission: deliver an outstanding patient care experience driven by a passionate commitment to excellence.
Compassionate, keeping the patient at the center of all we do. Demonstrating compassion for patients and their families. Supporting staff, professional staff, and volunteers so they are able to care for patients and each other. Operating as a team, both within WRH and with our partners, to provide exemplary care.
Accountable. Striving for accountability and transparency to those we serve and to ourselves. Driving fiscal responsibility. Stimulating effective two-way communication at all levels. And finally, facilitating timely access to care and service.
Respectful, treating those we serve and those we work with sensitivity, empathy, and honesty. Upholding trust, confidentiality, and teamwork. Communicating effectively. And finally, welcoming individuality, creativity, and diversity.
Exceptional. Promoting a culture of quality and safety, embracing change, innovation, and evidence-based practice, encouraging learning and discovery and knowledge sharing, and fostering dynamic partnerships.
Strategic direction number 1, strengthen the culture of patient safety and quality care. First, we're going to integrate standardized best practices to achieve quality, care, and outcomes. Second, we're going to lead in the development and performance of patient safety initiatives and measures. And thirdly, we're going to lead in the development of strategies that support timely, sustainable, and appropriate access to care.
Strategic direction number 2, champion accountability and transparency. Number 1, utilize the results from the performance indicators to achieve excellence. Number 2, cultivate and sustain a just culture across the organization. Number 3, strengthen systems that clearly identify, support, and measure accountability throughout the organization.
Strategic direction number 3, develop a sustainable corporate financial strategy. 1, maximize revenue opportunities while providing quality care in the most cost-efficient way. 2, provide ongoing education to the organization and community about how the hospital is funded through the health-based allocation model, quality-based procedures, and global funding. 3, engage the organization to identify and implement best practices within financial realities. 4, identify, support, and sustain core services.
Strategic direction number 4, create a vibrant workplace. 1, foster a respectful and safe work environment across all disciplines. 2, create a culture of pride that establishes Windsor Regional Hospital as an employer of choice. 3, provide experiences and opportunities that facilitate professional development, advancement, and succession planning. 4, Develop strategies to optimize attendance and support an engaged workforce.
Strategic direction number 5, strategically engage with external partners. 1, collaborate with community partners to deliver innovative, seamless system of care. 2, work with Leamington District Memorial Hospital and regional partners to identify and act on opportunities for collaboration. And 3, create opportunities for education and research to build an academic healthcare system that will attract and retain professionals from all disciplines.
Strategic direction number 6, continue the pursuit of new state-of-the-art acute care facilities. 1, design the facilities to allow for best possible patient outcomes and experience. 2, ensure the design incorporates leading-edge technologies and equipment. 3, design the facilities to support excellence and innovation in healthcare research and education. 4, ensure effective and meaningful participation of staff, professional staff, volunteers, patients, academic partners, and the community. 5, maintain and sustain current facilities until relocation to the new acute care facilities.
Hello, I'm David Mouche, President and CEO of Windsor Regional Hospital. Now that you've heard about our vision, mission, values, strategic directions, and strategic initiatives, you're probably wondering, okay, what's next? Well, what's next is we have to take those strategic directions and strategic initiatives and do what's called operationalize them. What does that mean? We have to make sure our hospital on a day-to-day basis live not only our vision and our mission statements and values, but the work we do has to follow what's in those strategic directions and initiatives. So how do we do that? Every single program across Windsor Regional Hospital will be working as a team. They will be identifying the work that they're doing currently and making sure it attaches to one of our directions or initiatives. If it doesn't, then that's work we shouldn't be doing. However, when there's a gap, if one of our directions and initiatives identifies something we are not doing as a program, we must start doing it. So it brings to life our strategic plan in our day-to-day operational activities. At the same time, we have to make sure whatever work we're doing, we measure it. Because the only way as an organization we are going to find out if the work we're doing is achieving our directions, our initiatives, our vision, our mission, is if we measure the results. So we measure the results going in and the results coming out. And we look at how can we improve a patient's journey through all of that while enhancing quality at the same time. So there's a lot of work to do to get this strategic plan to live and breathe. And the way we do it next is through operationalizing it program by program and throughout the whole hospital. So I look forward to everyone working together to make that a reality. And I hope you enjoyed our strategic plan for 2016 to 2020. Thank you.